Good afternoon and welcome everyone to Recognizing Infection Risks Session 3, Recognizing Risk Using Reservoirs, a review. This is the final session in our 3-session series on recognizing infection risk, and it's brought to you by Project Firstline Rhode Island under the Center for Acute Infectious Disease Epidemiology at the Rhode Island Department of Health in partnership with the CDC. I want to thank everyone for joining us today and taking the time to spend with us, and thank you all for the vital role you play in healthcare. Project Firstline intends to provide relevant information and training for all healthcare workers regardless of role: nurses, certified nursing assistants, environmental services technicians, doctors, allied health professionals, and other frontline staff in healthcare facilities in the United States. Before I introduce myself, I'd like to direct your attention to the chat where you'll find a link to our pre-session survey. If you haven't done so already, please take a minute to fill out the survey. It is required to receive a certificate of training for this course. My name is Stephanie Doyle. I'm an infection prevention training liaison for Project Firstline Rhode Island and a community public health nurse coordinator here at the Center for Acute Infectious Disease Epidemiology at the Rhode Island Department of Health. I've been practicing healthcare for over 20 years. I've worked in many different roles, mainly direct patient care. I've done some management and education. I am so excited to be here to present this topic to you and learn about your past experiences in healthcare and how those experiences have helped you develop your approach to providing care. The past few years have been very trying for all of us as healthcare workers, and the pandemic has impacted us both professionally and personally on many different levels. One important thing that we can take from it is that we need to stay vigilant and maintain high standards of care, especially when it comes to infection control. So again, I'm so happy to be here with you today for our 30-minute interactive refresher session. Before we get started, I'd like to introduce Abby Anderson. She is our Project Firstline Rhode Island project assistant, and I have the whole team here with me behind the scenes in support of this webinar. Abby will be posting information for you throughout the webinar in the chat. And if you'd like, please take a minute and introduce yourselves and let us know your name and where you're coming from. And if you're returning, welcome back. If not, so happy to meet you. Some housekeeping reminders. At the bottom of your screen, you'll see the chat box. Of course, you can use that to interact throughout the session, introduce yourselves, and if you haven't already, please add your email to be added to our distribution list. You'll see a Q&A box. Feel free to add your questions to the Q&A box, and hopefully we'll have some time at the end to go over any questions. And the raise hand icon, everyone is muted at this time. If you'd like to speak, please feel free to raise your hand to be unmuted. All right, let's begin. So on our agenda for today, we've done our welcome and our introductions. I'll go over some learning objectives. We're going to review recognizing risk using reservoirs. Then we're going to do an interactive session. I'll ask you for your input for this scenario that we'll go over, and we're going to look at how a germ spread to a patient. We'll bring everything all together, go over some key takeaways. I do have some announcements at the end, and I'll ask for your feedback, a short poll, and then hopefully we'll have some time for some question and answers. All right, so our learning objectives for today, at the end of the session, you should be able to recognize tasks in healthcare that can cause germs to move between and among reservoirs, and also recognize when to apply infection control actions to limit the spread of germs. All right, So recognizing risk using reservoirs. Quick review here. Recognizing risks. Risk recognition is seeing the potential for a problem to happen. But seeing that potential problem does not mean the problem will definitely happen. We take action to keep something bad from happening. It is important to know where the germ lives, the reservoir, a place where germs live and thrive. Once you recognize that risk and learn about the reservoir, then you can recognize a pathway, a way for germs to be spread from their reservoir to another reservoir or a person to infect. What are their pathways? And then in healthcare, we think about germ reservoirs in the human body and in the healthcare environment. Reservoirs in the human body are skin, the gut, the respiratory system, and the blood, body fluids. Reservoirs in the healthcare environment include water, wet surfaces, dry surfaces, dirt, dust, and devices. There are a few common pathways for germs to be spread from reservoirs in healthcare. By touch, breathed in, splashes and sprays, through the eyes, nose, mouth, to broken or unhealthy skin, and through things that we do as part of healthcare that bypass or break down the natural's body defenses. For instance, procedures such as surgeries require breaking the skin, and they allow germs from the patient's skin to get into their body. Anything that we do that involves touch, whether it's touching a person or things in the environment like equipment, blood pressure cuffs, tongue depressors, can be a risk for germs to spread. And we've reviewed in depth reservoirs and pathways, but there are more pieces to the puzzle of germ spread than reservoirs and pathways. Germs also need to arrive at a new person. That person could be a patient, you, or one of your colleagues. And in order to infect them, the germs need to get around the person's natural body defenses. If the person is already sick, their immune system could be weak and not able to fight germs as well as a healthy person's can. If their skin is broken from an IV or implanted port, any device that's implanted into their body, germs can enter their body through a break in the skin. Throughout all of these elements, the germs need to survive in the environment to make someone sick, and that is called infectious. Infection control actions that you take at any of these points help keep germs from spreading and causing infection. Now we're going to use what we know about reservoirs, pathways, and how germs make people sick to discuss a scenario. So how did the germ spread? So I'm going to present a brief scenario in which a patient has different interactions with different healthcare workers. And remember, the outcome of the scenario, in this case, we're going to look at Staphylococcus aureus. The outcome is that the germ has spread to the patient. So I'm going to ask you to provide potential reservoirs and pathways that could have been involved in the germ spread. And then we'll discuss common reservoirs and pathways and draw on your experiences to show how staff made this person sick. So first I'm going to ask, what do you know about Staphylococcus aureus? So you see a poll question pop up on your screen there. So I'll take a look at that. What do we know about Staphylococcus aureus? So A, Staphylococcus aureus is the leading cause of skin and soft tissue infections, such as abscesses, boils, furnicles, and cellulitis. B, also known as Staph or S. aureus, Staphylococcus aureus is a type of bacteria found on human skin in the nose, armpit, groin, and other areas. C, to prevent staph infections, practice proper hand hygiene, keep infected areas covered and clean, and avoid sharing personal items like razors, towels, and needles. Or D, all of the above. So take a minute, answer that question for us. What do you know about Staphylococcus aureus? All right, great. Awesome. You guys know a lot about staph. The correct answer is all of the above. Excellent. Excellent. So I'll just go over some basics about Staphylococcus aureus, which you know. Commonly called staph, it's a type of bacteria. Most of the time it doesn't cause any harm. It can, however, cause serious and fatal infections, especially in patients in healthcare. Some types of staph are resistant to antibiotics. I'm sure you've all heard of MRSA, MRSA, methicillin-resistant Staphylococcus aureus, which means that the germs have developed the ability to defeat the drugs that are designed to kill them. Anyone can get an infection from staph, but some groups are at higher risk. People with chronic conditions such as diabetes or cancer, and definitely patients in healthcare. So here's some research that the CDC has done, and they've put out some publications around staph recently. I'm not sure if you're familiar with this platform, the CDC Vital Signs Reports. So they cover an important health threat and what can be done to drive down the disease. So I wanted to point out this Vital Signs report. It's from March 2019. And this was published after findings of a 12-year study at the U.S. Department of Veteran Affairs medical centers, and it showed a system-wide sharp decline in Staph aureus infections following introduction of a multifaceted infection control intervention. This infographic details the study and shows key interventions that were proven effective in reducing infections and preventing poor outcomes. So I wanted to zoom in on the second page of the infographic and talk a little bit about what puts patients or people at risk for serious staph infection. So you can see there in communities, uncovered draining wounds, crowded living conditions, recent stays in healthcare facilities, sharing personal items, injection drug use, in hospitals, hospital stays requiring surgery during or shortly after, exposure to people who are carrying staph, people are colonized with staph, and exposure to those people, and medical devices implanted into the body or in the body, and outpatient surgeries like dialysis centers, nursing home stays, and again, in other healthcare facilities, medical devices in the body. And adults, this is another vital signs report that came out just this month, a few weeks ago. Adults on dialysis are 100 times more likely to have a staph bloodstream infection than adults not on dialysis. And Abby will be posting these links for you if you'd like for more information on these topics in the chat. All right, so now that we've reviewed, so I'm going to present this scenario. A patient in a room, and the patient is in the bed. So I want you to put yourself in this scenario. So you're watching the scenario and you see a physician conducts a brief physical exam, a nurse checks the patient's vital signs, an environmental service technician completes a daily room cleaning. So remember, the outcome of this scenario is that the patient gets sick with a staph infection. So review, recognizing reservoirs and pathways. So there are your reservoirs and your pathways. So focusing in on staph. We're going to focus on the skin and dry surfaces and devices. So that's where the staph is living. So the staph is living on the skin, and the pathway is through touch or bypassing, breaking down the body's defenses. All right, so now I'm going to ask you for your input. So I want you to put in the chat. So think about this scenario, patient in a bed, anything that you've come across in your line of work. What are some reservoirs during these interactions? So a physician conducting a brief physical exam. Let me know some reservoirs that the staph could be living on. And then what pathways? So the pathway is touch. So where is the staff living? Is it living on medical equipment, on the bed rail? Throw your ideas in the chat there. Nurse's stethoscope, mattress, stethoscope, hands, absolutely. Healthcare workers' nose, yes, can be colonized, definitely. Stethoscope, bed rail, hands, touching, equipment, excellent. Now how about when a nurse comes in and checks the patient's vital signs? Contaminated computer keyboard, absolutely. Scrubs, clothing, linens, absolutely. Yeah, say this patient has a dialysis catheter. What are some pathways? Port, TV remote, yep, call bell, absolutely. Now how about when an EVS technician completes the daily room cleaning? What are some reservoirs and pathways that staff might get to this patient? Think about breaking down the body's defenses. Does this patient have a central line catheter? Does this patient have a wound? Think about their eyes, nose, and mouth. Water, yep, trash basket. Everything can be contaminated. Not changing equipment between patients, absolutely. The IV pole. How about the stretcher, the mattress? Is that being properly disinfected between use? Catheter, Foley catheter. How about the physician with staff on their hands who doesn't perform proper hand washing prior to inserting a central line catheter? Or the wound care physician who doesn't properly disinfect their tools after a wound debridement? Are they using the right disinfectant? Absolutely. Excellent. Thank you so much for sharing. That was great. I appreciate that. And now think about your day-to-day work. Where do you work? Who do you come in contact with? What are you touching? Who are you touching? You identified several different opportunities during these interactions that staff could spread to the patient and make them sick. No matter your role, each patient interaction provides a risk, an opportunity for germs to spread to a patient. All in all, when we realize where germs live in healthcare, we can intervene and take action to limit and even eliminate germ spread. When we hold ourselves and others accountable, we can have good outcomes and reduce illness and infection. Great job. That's great. So now that we've gone over all these possible reservoirs, and there's many, many more that you can think of in all different scenarios, let's take action. Let's take action. Now I want you to, some of you already had placed this in the chat, but come up with some infection control actions that you can take to limit the spread of this or eliminate the risk of germ spread in this scenario. Hand hygiene, before donning gloves and then after removing gloves. Hand washing, good hand hygiene, wipe down equipment properly, proper disinfectant, foam in, foam out, wipe down bedside table, proper PPE, absolutely, surface disinfection, cleaning doorknobs, absolutely, those things that you might not think of that can carry these germs, the reservoirs. Patient hand hygiene, absolutely. Decon, yep. Cleaning equipment, stethoscope, pulse ox, good cough etiquette. Excellent. You guys are awesome. I really appreciate the input. Periodic cleaning of medical devices. So you hit on a lot of these. Better hand hygiene, absolutely. Take the time, step back, wash your hands. Do it the right way, do it the proper way. Cleaning and disinfection. Use the correct disinfectants. Using proper PPE, gloves that actually fit. And tying the back of your gown. So many times I've seen just gowns hanging. Just tie that necktie. Decolonization of patients and actually getting a good history from the patient to see if they've had staph in the past. And decolonization before any invasive procedures. And education of staff, educating yourselves to best practices and bringing that forward to your colleagues and using it in your day-to-day practice. Very good. Yes, equipment, storage rooms, all these things can, where staff can live, the reservoirs. All right, very good. Now we're going to bring everything all together for some reflection. Now that we've used our knowledge about reservoirs and pathways to recognize the risk for germs to spread, let's reflect on your work and your work experiences. What can you do differently? Thinking about your daily work, what is one step that you can take to recognize an infection risk and then take action? Take with you one action you can take to stop the spread of germs. And share it with everyone. In conclusion, here are your key takeaways for today's session. Germs are found in certain places where they live called reservoirs, and they also need a pathway to spread to other places and people. Things we do in healthcare can be pathways for germs to be carried from one reservoir to another, or into spaces that are not supposed to have any germs. When you understand where germs live and how they might be moved from one place to another or to people, you can recognize the risk for it to happen. When you recognize risk for germs to spread, you can choose the right infection control actions to keep it from happening. I want to thank you all for your participation. That is excellent. I really enjoy interacting with you, and I want to thank you for your time and attention today. I hope you can take these ideas with you and apply them to your day-to-day work. And before we wrap up, if you'd like to receive a certificate of training, you'll have to have filled out the pre-session survey, attend this live session, and the post-session survey will be emailed to you, and that link will close on midnight on March 6th. And then you'll receive your certificate via email on March 9th. So here are some resources, and please follow us on social media to keep up to date on our latest trainings. We have an exciting session coming up March 13th, Monday, 12 to 12:30, and that will be presented by my colleague, Lisa Ledoux, Infection Control Reminders During Respiratory Virus Season, a refresher session. That's very exciting, and Abby has posted the link in the chat to sign up for that session, and that's coming up in a couple weeks. Here are references for today's session. And before we close, I'd like to ask you to take a quick 3-question poll, and it helps us improve our future training sessions and better support your learning needs. Thank you all so much again. I know everyone has a busy schedule, but I really appreciate you taking the time to spend with us and support Project Firstline. And if anyone has any questions, feel free to throw those in the Q&A box. We have a few minutes left for any questions that you might have. And if not, thanks again, and I hope you have a great Monday and the great rest of the week.